My name is Bonnie B, and you are watching The Power of Perseverance. You guys, today I have Dr. Paul Winterton here with me, and what a fun conversation this is going to be because he is so versatile in so many things he does. One of the big things he's going to touch with us on today is stem cell therapy and how he's helping people heal with it. So, Dr. Paul, welcome.
Bonnie, thanks so much. It's a privilege to be here and talk about overall health and well-being. And of course, my passion for orthopedic and musculoskeletal health, particularly with regard to regenerative biologics or regenerative medicine. And that seems to be where the world is going right now, not only domestically, but internationally.
So I want to start from the beginning. What brought you into starting this wellness path into the stem cell therapy, and how long have you been doing it for?
Okay, so traditional orthopedics, what we call allopathic orthopedics, or you go and you get a medical degree or an osteopathic degree, regardless, traditional orthopedics is kind of knife to skin. The chance to cut is the chance to cure. and as exciting as that is, and it's the draw that makes us want to move into orthopedics. It's an exciting field. We use instruments. We use power equipment. They call us the Black & Decker boys in the operating room, and girls too. We've got, but we and of course we're all drawn because we have cobalt, chrome, and titanium and plastic, and we make joint replacements, and we do it for hips and shoulders and knees. It's exciting. But as time has gone by, it's clear that many people understand and are acutely aware of the risk-benefit ratio. Yes, there are great surgical candidates, but some people really are seeking the non-operative options.
So in short, how does this help when you're giving stem cell treatments, which I was in your office and you kind of walked me through some of this and I received some incredible benefits from these. You basically inject at certain locations patients with these stem cells, and over time, if I understand it correctly, it helps you regenerate new ones.
Yes. So what is a stem cell? A stem cell is an infant cell that has the ability to, one, replicate, and number two, to differentiate. But the misconception is that people think the stem cell is implanted with an injection somewhere and that stem cell behaves like a seed in a grass. The remarkable part of stem cells are their ability to become in close proximity to old cells, senescent cells, cells that are sleeping, and to become either revitalized or become young again. So you have a room filled with 80-year-olds and you have a little toddler stumble in, and just the proximity of that toddler being close to octogenarians, all of a sudden all the 80-year-olds become young again. And how do they do that? Well, as we get older and as we get more mature, our cartilage, our tendons, our nerves, our muscle becomes old. And when I say senescent, they fall asleep. They stop producing the proteins that they do. We start moving toward our age status. And stem cells, when they become in close proximity, they help the old cells that need to die, and the older cells to become young again. And they do that by cell-to-cell communication. Little bubbles or blebs come off of the stem cells and approach the older cells, attach to the plasma membrane, and release the stem cell products that tell the old cells to become young. And believe it or not, those stem cells and placentas are what direct the embryo, a brand new conceived embryo, how to differentiate all of the different organ systems. So stem cells have incredible power. And so we could get into where they come from, how we can get them, and how we can get them injected into us.
I caught where you said placenta, and I know it's not
Mhm.
the exact same thing. However, and I have to be very clear with my wording here because I don't want it to be misinterpreted that I ate my placenta because that is not what I did. But after my first child, I didn't have what you call those postpartum blues. I stayed very active, but I just didn't feel 100%. After my second child, I went a very holistic route, and I had heard of this thing called encapsulation with your placenta and taking that nutrient. And I don't know if you'd call them cells, but basically putting that back into your body, something that was using to develop the baby and the nutrients and your hormones and all of these things that were in there. And so when I think of stem cells, I kind of think of it the same way. I'm putting something back into my body to empower all of the support systems that are in there.
Yeah. We usually don't ingest stem cells. Stem cells are either delivered IV or given it directly injected into either soft tissues like tendons or into joints. And indeed, the regenerative capacity of these infant cells work their magic. And it's not magic, it's highly defined, clarified science. A very exciting technology. Now, we bring in the placenta. The stem cells that are available for clinical application come from full term placentas that are delivered via C-section. And
Okay.
we're able to morselize fragments of that placenta. We're able to isolate those stem cells, or what we call medicinal signaling cells. And then once we isolate them, we're able to put them in culture and expand them into millions of stem cells. And then you can take that collection of 50 million or 100 million stem cells and deliver it systemically through an IV, or even just as exciting, locally. Now, I'm an orthopedic surgeon. I'm a musculoskeletal specialist. I inject these stem cells into certain parts of the extremities or spine. And that's how we apply these
So by me
technologies.
encapsulating, I mean, I'm
Mm.
sure I'm not right here, but by me encapsulating that placenta where they dehydrated it and put it in capsules and I ingested it, would you say I was getting some stem cells in a different form? I mean, I just kind of thought of that as you were talking. I was like, I wonder if I was getting some of those benefits, or because of how it was broken down, it wasn't live. So it's really not the same thing.
Well, before I answer that definitively, I probably have to learn about the processing of
Oh,
encapsulation. But there's no question that if you were to take a placenta and freeze dry it and take that, you would have the biochemistry that would be great, very beneficial. Whether any of those stem cells preserve their vitality, uh, and what percentage of that freeze dried material that's encapsulated. So, but it's a very interesting concept. I should probably look more into
it
placental
is,
uh,
isn't it?
processing. Maybe I'll talk to my team in Guadalajara, Mexico. By the way,
Yeah.
many of these technologies are not available because the FDA and the CDC and Big Pharma don't want them. There are no scalable profits available for Big Pharma and the CDC and the FDA to engage in the processing of stem cells in clinical application because they can't patent it. You can't patent Mother Nature.
You really can't patent Mother Nature. But my point too in telling you that was I noticed a tremendous difference when I took that hormonal wise. What it stimulated for me for my breast milk for when I nursed my son. And so then thinking back to when I came to your clinic and we did the facial where we put the stem cells on my face, my skin, I mean, I naturally have genetically good skin, so I'm lucky there, but just the glow improved tremendously.
Yeah, well, I can see. By the way, Bonnie and I are communicating via Zoom. So you're looking remarkably, I guess, youthful in your deportment and appearance and visage there. So
Thank you.
congratulations.
Thank you. It's good to be 22. So for what I think is really cool about Dr. Winterton is he trying to get this podcast nailed down was quite the task too, because not only are you enjoying innovation within your clinics and bringing all of these things to light, but you are out traveling and doing some really fun activities. Where were you last week?
Yeah. Well, last weekend I was paddleboarding down the Snake River in Jackson, Wyoming. Weekend before I was kiteboarding with the U.S. Olympic kiteboarding team in Long Beach. The week before that, I was kiteboarding on the western shores of Portugal, and the month before that, I was in Scotland riding bicycles. So I guess I I guess as far as well-being and overall energetic health, I'm enjoying a time in my life where I have access to these technologies, I have access to this science, and I really, really have an abundance of energy. And although I'm a full-time orthopedic surgeon, I do take time to play even harder. So
Hey, you know what? There's nothing wrong with that if you believe you live once, right? But
yeah.
being right now, as you said, enjoying your life, what you know now, what would you, if you could hypothetically, just for fun, hop in a time machine and say, you know what, knowing what I know now in the medical industry, is there anything you would have done differently starting out?
Well, I would, yes. Knowing what I know now, I would have probably gone into musculoskeletal health or urologic specialties. But knowing what I know now, I would not kneel at the altar of the Food and Drug Administration. I would
Mm,
not kneel at the altar. From the very beginning of our allopathic training, traditional medical school, we really hail the name of our what we thought was hardcore science-based clinical application. What we've learned in the last 30 years is medications, synthetic medications, are highly destructive to our well-being. If you look at the history of big pharma or pharmaceutical development, it's
yeah.
largely driven by scalable profits. And yes, there are some wonderful, miraculous benefits. However, I would say the vast majority of pharmaceuticals, that is synthetic medications that are developed and dispensed by our pharmacies, the synthetic ones are truly, truly destructive. And I just have to speak very frankly. I call the FDA and the CDC I hope this isn't too controversial, Bonnie, the criminal alphabet soup.
You
They
know,
are they
I
are
don't think
destroying.
it's, yeah, go
Go
ahead.
ahead.
Nope, go ahead.
They're destroying more lives than they're saving. I just have to say that.
You know, I would actually concur with you. It's what brings me to be so passionate about working with Ketone Labs and the work that they're doing. Having some of my own health issues at 30 years old, you know, I go to these doctors, as you said, if you could go back and understand maybe nutrition and how things are being more band-aided rather than getting to the root cause. I went to the doctors and I said, hey, listen, these are my symptoms. And they threw medications at me. They said, well, it's your thyroid. But what they didn't address is, okay, she's got an overactive or an underactive thyroid. What's going on in her environment? What's going on emotionally, physically? What's in her diet? And I related it to being maybe it's just because I'm a bodybuilder and maybe I didn't do something right. And instead of addressing inflammatory issues or cause and effects, it was let's throw medication on it. And after 2 years, about 3 years of being on thyroid medication and then having them say you should have ADD medication, because I had so much going on in my environment, I didn't understand how to really relax that central nervous system. They put me on a medication. I didn't like how it made me feel. Um, who I was as a person, as a mother, it changed a lot of my personality. And I said, I'm going to be on these the rest of my life because all they're going to do is increase my dosages. My weight's not really changing, and my thyroid, I still feel exhausted. So there's got to be something more. So coming to doctors like you who care beyond the prescription writing realm are doctors that have been able to help me get to root causes through nutrition and, like you said, approaching things in a more natural way because our body is going to heal faster when you bring it closer to Mother Nature.
That's very well said. And what may have been your narrative that you just completed may have been considered 15 years, 20 years ago as kind of hand waving shall we say, kind of hippie talk, is
Yeah.
now being borne out in the literature as truly the best way to move forward with so many things from a hormonal, physiological, biochemical approach, leaning on the wonders of uh, Madre Naturaleza, Mother Nature. So, yes.
Well, aren't we all just trying to make it home in some kind of sense, home to homeostasis, bringing our body home, our mind home, our spirit home, our physical home to a place of grounding and a sense of making sense? And what makes sense to me is to do it the most natural way, which brings me into you have also been a part of the Real Ketones growth in the past and are one of our preferred partners when it comes to the exogenous ketone. And so, if you want to go ahead and touch on where you feel like that can benefit people, this would be a great point to bring up right now.
I would love to. So, what we put in our mouth, what we consume as Americans and as human beings, has a clear direct causation on how we move forward and the amount of energy that we have and the amount of cognitive capacity we have, both short, mid, and long term. Exogenous ketones is a word that crossed my path about 9 years ago when I had heard about ketones. I had heard about, ketoacidosis and what happens to diabetics. But what I was very uneducated about, even having attended Harvard Medical School and graduating with honors, we never had any instruction on nutrition. If you can believe that. Internal medicine, what pill can you take for this and what part of the anatomy can you alter with this knife? Exogenous ketones. How do I put this in 5 sentences or less? Well, that's impossible. But we have 2 fuels in our body. We have carbohydrates that many of us think that's what we get. That we eat carbohydrates, it turns into glucose, and that gives us our energy. Well,
Yeah.
It turns out that the vast majority of mankind who have ever lived get most of their energy not from carbohydrates. There are no essential carbohydrates. Our bodies do not need carbohydrates. Our bodies need fatty acids or fats. And the vast majority of our humanity, from the moment they're born and are suckling infants to adults, get most of their energy through the history of time by consuming fats. And of course, carbohydrates are to glucose as fats are to ketones, or what we call BHB or beta hydroxybutyrate. And if you can train your body to draw on fat as the main source of your energy, and there are many ways to do that. Of course, the most exciting way right now is this idea of intermittent fasting, where we have our last meal at 6 p.m. and then we kind of forego breakfast and then we have a nice healthy lunch. During that time, your body screams, I'm being starved. I'm going to mobilize my resources. What resources do I have? That belly and flank that has fat in it. Boom, mobilize that. Now that's difficult because during that transition of moving from primarily glucose to energy to beta hydroxybutyrate or ketones, you can get headaches, you can get cravings.
Yeah.
Enter the great world of exogenous ketones. And I've been relying on exogenous ketones. And what they are, we actually can synthesize that macronutrient, beta hydroxybutyrate, where you can take it in a quad salt form that's attached to sodium, potassium, magnesium, or calcium, and it's mixed in with medium chain triglycerides. You take that, you're immediately in ketosis. Your body says, okay, you're no longer starving. You have plenty of energy. And if you want to transition to what we call keto adapt, to help you lose weight and have mind-blowing energy, exogenous ketones is a great transition and a sustainable way to maintain that. So when you enter the world of disciplined food consumption, and perhaps intermittent fasting. And you don't want those side effects of transitioning away from refined sugars and refined carbohydrates. Exogenous ketones are the way. That's a lot of hot air, but it has been transformative for me. You see, Bonnie, in my hand, I have
Yes, your water
my
bottle.
bicycle bottle, my water bottle. Every day I have my bottle of exogenous ketones, and the horrible bonk. I ride bicycle 30 miles a day. I commute back and forth from the hospital. Back in the day, I would have to stop and get my bag of Lay's potato chips to protect myself from the bonk. I don't drink coffee. I have to operate, so the jitters, I can't have that much caffeine. So exogenous ketones have completely kept the afternoon bonk away. There is no such thing as a coffee break for Dr. Winterton, because I wake up at 5:30 and I go to bed at 10:30, and I am annoyingly energetic for those for that time,
Hey, I wouldn't say
because
annoyingly. I think it's good to be sharp and hopping around at you. I don't want to insinuate you're old, but you're not old, but you are older, right? So to have the kind of energy you have at your age and doing the things you're doing, enjoying your life, and you're doing it not suppressing your neurons with stimulants and high amounts of caffeine, that speaks volume for how this cellular energy is really making, you know, I guess it's a great support to all the activities you're doing physically.
it is. It's transformative. It's changed my life, and it's and I think you can keto adapt. I mean, you've got to watch. You've got to still. You just can't live on exogenous ketones. I mean, you have healthy
Right.
fats and avocados. Instead of eating rice, you have morselized cauliflower, which is a very healthy complex carbohydrate. Instead of pasta, you have spiralized zucchini, a very excellent source of complex carbohydrates. And there are ways to keto adapt and move away from the significant problem in the American diet of simple or what we would say refined carbohydrates and refined sugar that's destroying the health of Americans.
I guess you could say I am technically keto then, because I think most people think keto initially who aren't educated think dirty keto, bacon, eggs, high fats, which I think is really hard on your system. When I think keto and nutritionally eating, I think leafy green vegetables, low starch vegetables, all whole foods, and healthy lean meat proteins.
That's the best description as I can do. And I think instead of thinking Atkins means keto adaptation, it
Yeah.
is smart, mindful, healthy eating, as you just described. You need to have energy, though, Bonnie, and you need to provide your body that energy. And if you can find that energy with appropriate ratios of proteins, the problem is too much protein. There's a there's a, there's a particular process in your body where you undergo gluconeogenesis. If you have too much protein, it can be shunted into making too much glucose. But your body needs a healthy amount of protein to increase muscle mass. And that takes us to the very important concept of longevity and its relationship to, drum roll, muscle mass and resistance
Muscle
training.
mass.
There's no question, there is full 100% international consensus that the number one key to longevity, aside from everything else, even just nutrition in general, is regular daily increases in muscle mass through resistance training. You don't have to go to the gym, but you need to be engaged in daily resistance training to keep that muscle mass, because if you get those muscles up, you have a place to store your glucose in the form of glycogen, and you really avoid that muscle mass will increase your cognitive capacity, your ability to move, your ability to do the things you need to do to maintain an active lifestyle to keep your body and mind healthy. So there's a little soapbox that I don't think we talked about before the show.
Do you offer nutritional structuring for clients at your clinics?
Yes. So if someone comes in, and that's a really sensitive topic, Bonnie, as you might imagine. I
Yeah.
see people with joint pain. I see people with body mass index, which is now a politically incorrect term, but I'm still going to say it. Body mass index is a
Yes.
ratio of body weight to size. So if you're 6'8" and you weigh 280 pounds, that might be within the realm of normal. If you're 300 pounds and 4'11", you're going to die soon. And people come into my clinic and are desperate either to just finish their life or desperate to transform their life. And I'm so glad you brought
Mm.
this up, because the vast majority of patients who come in with joint pain come in because gravity is really bearing down on their joints and it hurts and they're miserable because they say, I'm too heavy, I can't exercise. And so they're very desperate to find some way to turn that, should we say, that big boat around. You just turn that lifestyle. 85% of the maladies that we suffer in humanity are completely reversible and can be reversed by lifestyle change. So you can turn that Titanic around with healthy choices of living and function. And yes, patients come in and I spend a lot of time discussing what they can do in a reasonable way, in a practical way, pragmatic way, to get that gravity changed and to start making the changes in life. The sad part is many people look at me, they slump in their chair and say, I'm 48, I've lived my life. I think I just want to
Mm.
find a place to waste away. And it's
They don't
devastating.
value the rest of the quality of their life because there's no, well, they said it, there's no quality there for them. They're just ready to be done.
Yeah, it's devastating. And it is, look, it's not easy if you're 5'8" and 300 pounds to lose
Yeah.
100 pounds. It's not easy.
Well, choose your hard, right? Either choose the discipline and the pain of the idea of thinking you're missing out on unhealthy foods that are inflammatory, or choose the pain of eating those inflammatory foods and dying early and missing out on really so many valuable things you can be doing with your life.
You know, it's so astute that you just brought up the term inflammatory foods. One of the greatest mistakes that modern healthcare, modern medicine has espoused is that foods high in fat cause, I mean, you've heard it. It's,
Yeah.
you know, are you going to take that gut bomb, that burger, and you're going to, it's a coronary disease. You know, what happens is when you eat refined flours or refined sugars, it causes inflammation in your body. Your joints hurt, but even more dastardly, those refined sugars and refined carbohydrates cause scarring of the intimal inner layering of your coronary arteries and your carotid arteries that feed your brain. And
Ooh, just
that's
hearing
what,
you say that alone, I don't want to eat.
yeah, it literally causes scarring. And then those scars collect the cholesterol and fats, and then you die of a coronary. If you've noticed, we haven't had a dearth of coronary events despite our attempts to decrease, you know, to walk down the center aisle and say, this is a low-fat food. Yeah, Twizzlers licorice. Yeah, there's no fat in there, but it's gonna kill you with the sugar and the refined carbs. Or you go down the yogurt aisle,
Yeah.
heart healthy. Yeah, with 38 grams of sugar in that, pardon the name, Yoplait. You know, it's going to kill you, and it's going to kill you slowly.
You know, what's interesting about what you just said about that is I had met a friend yesterday at the gym, and she was giving me some information about her background. And she worked, I won't say the name, but a very, very prestigious marketing company, like the highest in her career she could go. And she said she worked with a really big popular cereal brand. And the cereal brand, I'm not going to say who they are, but what she told me was very shocking. She said, how do we get people, even though the cereal is not healthy for them, how do we get them hooked on it? And and it was a whole marketing meeting about how to get people addicted to their cereal to grow sales, obviously. And I just went, oh my gosh. And she's like, that's when I said, I can't do it. You're going to try to market to these children, these people to get I'm done. I can't do it because I am not ethically doing something right. And she quit her job making six figures and went into personal training and health and wellness well-being and is educating women and children on how nutritional benefits of whole foods.
Wow.
And took a huge pay cut because the people who do the most valuable work seem to not get paid the most, is what I'm finding too. Do you ever feel that way? Like you do the most valuable work, but it's not.
Well, you're right. It's my privilege to work as a physician and a healthcare provider.
Yeah.
The story you just told, boy, it just triggers me.
Triggers.
If you look me up on YouTube, you'll see me do videos talking about cold cereal, part of a balanced breakfast,
Yeah.
loaded with essential nutrients and 1,000 milligrams of sugar for your kids to go and enjoy a nice morning of complete bonkery where they can't even think because their brains are so
Oh, a
overwhelmed
high.
with sugar. And then you said something very interesting. How can we help people crave this? People that refined sugar is addicting. We crave it. Some say that it attaches to the same receptors as cocaine. And for those of us
Mm-hmm.
who are keto adapted, we know that if we take that chip or that Chips Ahoy, that buzz, those are such powerful chemicals, but unfortunately we become addicted to them and to the intense rush of pleasure you get when you eat those foods. And of course, breakfast cereal is perhaps the most profoundly worst thing you can put in your pie hole. So,
I do
oh,
have a disclaimer. I am guilty. I do buy those cereals on occasion because my kids are like, "Oh, can we try it?" But what has been so cool about it is when I have, which I mean, we went on an overnighter and I was like, I don't want to cook. I'm being lazy. Let's be real. I was a lazy mom and we had cereal for dinner. And after we
yeah.
all ate a bowl of sugar, we all felt like crap. And we all looked at each other and we said, we do not want to do this again. But to the point, I have conditioned them that that's not their daily meal to
Good.
where they're having it every once in a while. And it's a reminder like, okay, I like the idea because it's marketed to me that it should be good and all my friends have it. But in reality, it doesn't make me feel good. And that's what's most important is they noticed how it made them feel. And I gave them the choice the next time. I said, do you guys want cereal? Because I was curious what they'd say. And they said, no, we don't want to feel that way again. So by creating that conscious choice for them, I empowered them to make a different one the next time. But I am
Well,
guilty. It happens.
Well, Bonnie, you're just a walking, breathing springboard into ideas because that very idea, the idea of abstinence, look, if you're going to go out and have a good time with your kids, yeah, get some Hostess cupcakes. They're fun. Ding dongs, I love. I love to peel
Yeah.
off I love to peel off the processed chocolate substance on ding dongs. But I never pass. Abstinence should not be part of mindful, healthy eating. Uh,
100%.
you've got to walk past that plate of cookies and you've got to take one and you've got to nibble on it and maybe
Yep.
throw half of it away. Do not pass up that bowl of potato chips or tortilla chips. You take one or two and you savor it and enjoy it. And then in a disciplined way, once you've keto adapted, once you've got these exogenous ketones and intrinsic ketones floating in your body, you have the willpower to say, that was delicious. Now, where can I get something that won't make me feel like crap? And then
Right.
you get, but I would say never abstain. If you're going to go on a bike ride in Europe and you're driving through the hills of the Napa Valley hills, you don't just pass up a little bit of Pinot Noir. I mean, you
No, you
simply have
don't.
to do that. And you don't pass up a nice little half a donut, but you go out and then you have a lovely, yummy, fatty salad with lots of Mediterranean oil, olive
Yes.
oil. So, do not abstain. Do not, because what happens then is you crave. And at 11 o'clock at night, out comes the, quiet binging that so many of us have fallen victim to. But you can avoid that by diverting your body's cravings with exogenous ketones and keto adaptation. and healthy eating. There.
Man, thank you, Paul. Where can people come find you to read more about what you're doing at your clinics and potentially schedule with you if they're interested in some stem cells?
Oh, well, my name is Paul Winterton. You can Google me. You can call and say, I heard that guy on a podcast. I need to talk to them. And all of my receptionists and my medical assistants who have been with me for 20 years will annoyingly say, you've got another call about exogenous ketones and stem cells. And I will answer and personally talk to anyone who calls. Now, of course, it won't be immediately. But if you want to come in and see me off or on the record, you call my office and set up an appointment. And if you say, hey, I heard them on the podcast, I am now therefore a VIP and need to see him as soon as possible, I will. If you want to come to my 4 clinics in Mexico, in Puerto Vallarta, Cancun, Cabo San Lucas, y Guadalajara, you can call me and we can see you in clinic and prepare you for a wonderful experience there. And just a really quick pitch, Bonnie, if you'll indulge me.
Yep.
Women and men enjoy to go there. You can get stem cell injections for scalp, face, neck, for all the cosmetic issues. For extremity issues, we do a lot of injections of the arms and legs and spine. And of course, there's sexual function where men really enjoy the wonderful effects of stem cells as they have those parts of their body injected to help them with that type of function. And of course, women, older women that have some pelvic floor issues can really be helped with stress urinary incontinence for injections in and around those areas. And particularly with sexual function, both men and women enjoy the great benefits of increased climax and those types of things. We have an excellent gynecologic service there, and we have an excellent group of urologists that help. And of course, I'm the orthopedic extremity musculoskeletal guru regarding that type of application.
You know what? I'm totally transparent and I'm open about things that I try and do because I think that gives people opportunity to ask questions if they're nervous. And aside from the facial, I did have, after having children, things were different. And after having those injections where I got them for my female, to be really quite frank, when I jump on the trampoline, it was all coming out. So I have noticed since then, I pee my pants a little less. And it has really made a difference in the feeling down there. So I can attest that those things do work. So thank you for having me down in your clinics when we did the work there.
Congratulations, Bonnie. It is a wonderful service. Yes.
Okay, so here's your last question to end this conversation. How would Dr. Paul Winterton define a meaningful life?
Ooh, that's a great question. You know, the jealous eternities, those who have passed on look down at us and say, oh, if you would just enjoy that mortality, that narrow window. That is what I guess I better just hear that question again. Repeat the question.
How would you define in one sentence what it is to live, or what is a meaningful life to you?
To wake up in the morning with gratitude for another day, with the energy to engage that gratitude in healthy living, with compassion for those who don't have that capacity, and with the capacity and loving kindness to help bring people along with you to go kiteboarding every week.
I love it. You are living it up. Yes, it's perfect. It's always perfect. So, hey, thank you so much for joining us today.
My privilege, Bonnie. Thanks so much.
Thank you for listening to today's episode. If you like what you heard, please share it and help us keep the conversation going. We can't grow without you. So, thank you in advance for your support of Power of Perseverance.